Hello everyone, I'm Dr. Monica, Assistant Professor from Wales University. In this video, I'm going to discuss with you all about asthma. Regarding asthma, we'll be learning about the definition, prevalence, triggering factor, types of asthma, clinical manifestation, pathophysiology, diagnosis, and treatment. Asthma is a chronic inflammatory disorder of the airway in which many cells and cellular elements plays a role, such as mast cells, eosinophil, T lymphocytes, macrophages, neutrophils, and epithelial cells. It is a progressive respiratory disease characterized by inflammation of the respiratory tract and spasm of airway bronchial smooth muscle. This results in excess mucus production and accumulation, obstruction to airflow, and a decrease in ventilation of the alveoli. The prevalence of asthma is increasing globally. According to World Health Organization, an estimation of 262 million people around worldwide and 4,55,000 deaths were reported. Next, we're moving on to the triggering factors of asthma. The triggers vary from person to person. Some people react to only a few while others react to many. If the person is having asthma, it is important to keep track of the causes and triggers that the person know make your asthma worse. Because the symptoms do not always occur right after exposure, this may take a bit of detective work. Delayed asthma episode may occur depending on the type of trigger and how sensitive a person is to it. Coming to the various type of allergies, here I'm giving some of the examples for the triggering factors of asthma. Allergies such as dust mites, cockroaches, and then pollen, animal danders, rodents, and then irritant in the air such as smoke from cigarettes and other tobaccos, wood fire, charcoal grills, dust and particle in the air, and chemicals. And certain health conditions are also inducing the asthma such as obstructive sleep apnea, chronic obstructive pulmonary disease, GERD, obesity, and pregnancy. There are certain medication that will also trigger the asthma, aspirin, NSAID, and then beta blockers. There are seven types of asthma. First one is allergic asthma. Substance that cause allergies can trigger asthma. If you inhale something you are allergic to, you may experience asthma symptom. It is best to avoid or limit contact with known allergens to decrease or prevent asthma episode. The second type of asthma is non-allergic. It is also known as non-atopic asthma. It is a type that is not related to an allergy trigger like pollen or dust mites. It's less common than allergic. About 1 in 5 people with asthma have non-allergic type. Non-allergic asthma often develops later in life. Third type of asthma is mixed asthma. In this type, there are mixed form of between allergic and non-allergic asthma. In many cases, a mixed form of asthma develops from an originally allergic asthma. Therefore, the distinction is not always clear. This is because those affected react with asthma symptoms equally to certain allergens as well as to unspecific triggers. The fourth type of asthma is cough variant asthma. It is a type where a dry cough is only the symptoms. The patient won't feel any other traditional asthma symptoms like shortness of breath or wheezing. The triggering factors such as exercise, cold air, and weather change. Fifth type of asthma is exercise induced asthma. Some people with asthma only have symptoms like shortness of breath, chest tightness, wheezing, or coughing when they're doing exercise or physically demanding task. This is called exercise induced asthma or exercise induced bronchospasm. Next, coming to the sixth type of asthma, that is nocturnal asthma. It includes symptoms like chest tightness, shortness of breath, cough, and wheezing at night, and it can make sleep impossible and leave the patient feeling tired and irritable during the day. These problems may affect overall quality of life and make it more difficult to control daytime asthma symptoms. Nocturnal or nighttime asthma is very serious condition. It need a proper asthma diagnosis and effective asthma treatment. Next, coming to the last type of asthma, that is occupational asthma. It is a type, it is caused by the exposure to inhaled irritants in the workplace. It is often a reversible condition, which means the symptoms may disappear when the irritants that cause the asthma are avoided. Next, coming to the pathophysiology of asthma, I have simplified the pathophysiology to make you all understand in a smooth way. First of all, when the triggering factor is being entered, it leads to the inflammation of the airway. That ultimately causes the hypersecretion of mucus, number one, and number two is airway muscle constriction, and number three is swelling of bronchial membrane. All these things lead to the narrowing of the breathing passage, which leads to the asthma symptoms. Symptoms of asthma such as chest pain, severe wheeze, pale face, spasmodic cough, rapid breathing, choking, blue lips, and shortness of breath. Diagnosis of asthma include collecting the patient medical history, lung function test, physical examination, and methacholine challenge test. It is a different kind of test in which the patient is asked to inhale a dose of methacholine, a drug that can cause narrowing of the airways. A breathing test will be repeated after each dose of methacholine to measure the degree of narrowing or constriction of the airways. And last is peak flow testing. Treatment of asthma include anti-inflammatory therapy, corticosteroids, bronchodilators, long-acting beta-2 adrenergic agonist, anti-IgE therapy, and in non-pharmacological treatment therapies like chiropractic, relaxation therapy, and then yoga, certain lifestyle modification can also plays a role in the management of asthma.